In any health system, the most complicated and difficult situations to navigate are also the most complicated and difficult medical situations. And as your care becomes more involved, patients can sometimes get lost in the system. And St. Mary's and Mercy Health have done a great job to create systems, nurses and physicians and caseworkers who are present specifically to help patients navigate efficiently these most complicated and time-sensitive situations. There's also been a big investment in case management staff to help all patients, whether they're inpatient, outpatient, or in the ER, get through to the providers and the staff members that they need. There's been a lot of growth within Mercy Health with the Express Connect transfer line to accept all patients from outside communities to give them exposure to what I believe is our world-class system. That has helped us gain a broader audience. It's also helped us have a group of staff members who are always available to help physicians like me who are already in the system navigate through what sometimes could have been a difficult pathway to get patients the extended care that they need. One way that we're try to be present to all patients in all situations is the 24-hour on-site translator service that is, from my perspective, an integral part of my ability to care for all patients. I have not previously been exposed to another health system that does their best to be so available, whether it's in person with multiple languages that are available or over the phone with some of the more smaller populations in the community. There's always translating services available, so nobody has to feel like they can't communicate their needs. There has been significant growth in the ability of patients to access their physician's staff or their physician's office 24 hours a day to ask any question that they need and to be directed towards the most appropriate care. The staff members in all of our primary care offices are able to pretty clearly tell patients what level of care they might need for any situation. And anything from express care at the primary care doctor's office, which is available every day, to the urgent care centers, which are all over the system, to one of our many ERs, which are also doing their best to move patients into and get seen by doctors within as short a period of time as possible. I think anybody who's seeking out medical attention really wants to feel like they are being cared for by knowledgeable and skilled people, that they're in a system that is able to give them what they need, that is able to provide world-class care in their backyard. And I think that when people experience what is happening at Mercy Health, they get that feeling, and it's at the same time local and community enough that they get the feeling of being a family. I believe strongly in the case management staff at St. Mary's, and I've recently had an opportunity to work with one of our staff members who was put in contact with a specialist in the community who had reached out to her to try to help a patient who had recently become underinsured and in general didn't have any access to health care anymore. And although neither the physician nor the patient were part of the Mercy Health family at that point, she spent her time to go out of her way to make sure that she could aim the patient and the physician in the right direction to get the patient the care they needed. I think that was a bold statement of what Mercy Health does for patients, but also what the mission has always been of this health system. In any patient encounter, whether it's in the hallway or in the cafeteria or, from my perspective, in the emergency room, we are all present at all times to provide them what they need, whether it's a small piece of information or some guidance or some complicated medical help. I think it's important that we remember that every moment for them is the most important one.